Cool. So today I got Philip Analogy, who's currently the director of performance and director of sports science at Indiana Pacers. So Philip, can you like introduce yourself a little bit?
Yeah, thanks very much for the opportunity to sit in on your podcast. Yeah, my name is Phil Anloague, and as you mentioned, I'm with the Indiana Pacers. As far as my background goes, I don't want to bore you too much with it. I'm a physical therapist, a doctor of health science degree. I'm a board certified orthopedic specialist, certified manual therapist. I've been in academics for 28 years. I was PT faculty for 10 years in orthopedics. And then at Andrews University, then I moved on to found the Doctor of Physical Therapy program at the University of Dayton. I've taught in gross anatomy, orthopedic, sports medicine, and was the chair in that program for about 15 years or so. And then I became the associate provost for graduate academic affairs at the University of Dayton and did that job for 3 years, kind of overseeing all graduate programs, kind of as their graduate dean. Throughout that time frame, I've always done research, of course, and in kind of baseball and basketball in these areas. I've done consultation with elite sports, from collegiate to NBA, Major League Baseball, some NFL, and did that kind of throughout my career. For the last 12 years, I had done some research projects mainly with the Indiana Pacers, the Denver Nuggets, the Oklahoma City Thunder, some work with a couple other teams kind of here and there. And then last year I made the switch and took on a full-time position with the Pacers, as you mentioned, as director of performance and sports science. Again, don't want to bore you too much. I own two physical therapy clinics. One physical therapy clinic that's mainly outpatient orthopedics and sports medicine. Another is also in sports medicine, and we do performance and training and skill training and so forth there as well. It's called the Ryan Sports Medicine. I'm an academic, I'm a researcher, I'm a clinician. Consider myself a performance physical therapist, certainly.
Nice, nice. So I know I send you like all the list, like a list of questions I want to ask, but like I kind of want to start with this. Like, there's like strength coaches like all around the world, and I know like elite sport right now, they like want to hire like like strength coach who has background or like DPT background. So can you share a little bit your thoughts on like how does like your background kind of help you as like your role right now?
Okay, yeah, that's a great question. I think the nice thing about, someone who has the PT education and background kind of coming into a performance or a strength coach type of position, um, you know, really kind of works well together. I think some of it also depends on what their experiences in the undergraduate world kind of look like before they did their doctor of physical therapy degree. So the ideal situation is maybe someone who had that exercise science, exercise physiology, kind of the strength and conditioning background, and maybe earned their doctor of physical therapy degree. For me, when I think about what a performance physical therapist does, is they hopefully have a strong background in, again, exercise science, exercise physiology, strength and conditioning, anatomy, and biomechanics. But what I think I bring into the performance aspect is kind of the training as a physical therapist and that background as a physical therapist to be mindful not only about strengthening, conditioning, and performance, but being mindful about anatomy, mechanics, pathomechanics, pathoanatomy. How can we be mindful about the performance programs and the interventions that we're introducing to try to minimize the risk of injury? I think to to say that you can stop injury is impossible, right? Because injuries are going to occur. But what I do is I take the knowledge, the tools, the thought processes, the philosophies that I have as a physical therapist, and I apply them into the weight room and I apply them into my strength and conditioning and performance programs. Whereas a physical therapist, I might look at something and use my hands or get them on the table and treat them in that manner. And I can still do that. But sometimes I'll take that information, that assessment, and try to determine, what type of exercise might help me to allow the athlete that I'm working with to move better, to perform better, to generate forces more efficiently. So I feel like some of my tools are still in the realm of physical therapy, but many of my tools, of course, are in the weight room.
Nice, nice. Because uh this summer I went back to like Taiwan and interned at a physical therapy center,
Mm-hmm.
and I thought it's all gonna be like movement assessment, all those stuff, but it
Mm-hmm.
ended up like learning a lot of like biomechanics and how to
Mm-hmm.
use it with sprinters, with track athletes, and with basketball players. It's
Mm-hmm.
not like I took biomechanic courses before, but like it's like in like real world, how do you do that stuff? It's different.
For sure, for sure. I think something that we think about in the performance world with regard to, the ability to generate force or the ability to absorb force is something that's at the front of our mind, right? How are people moving? How are they generating propulsive forces or absorptive forces? And how are they speeding up or slowing down? For me, when I bring the information that I have as a physical therapist kind of into that equation, I'm certainly still very interested in the force production, the rate of force development, the numbers, how that is being developed. But I feel that my background in physical therapy allows me to continue to think qualitatively about those forces. So I'm not just concerned with how much force or how fast a force is generated, but how is it generated? And I'm not saying that other strength coaches who aren't physical therapists don't do that. That's not what I'm saying at all. But for me, I feel like I have that qualitative lens that says just because two athletes can generate a similar amount of force, how someone is generating might make me feel better about their risk of injury or their ability to minimize the risk of injury depending on how they're generating it first, if that makes any sense.
Yeah, yeah, because like I do feel like a lot of like strength coaches nowadays focus too much on like output
Mm-hmm.
and and like they're kind of missing that, like you mentioned, how they produce the force,
Mm-hmm.
and that's like so important.
Yeah, and there's tricky balance there, right? Because the end result can still get them, that NBA contract, and I don't want to take that away. I don't want to take away what makes someone special. That's the number one rule, right? When we're working with athletes is, facilitate what makes them special. There's characteristics, that got them to the level of the success, that they've achieved. So I don't want to take that away from them. So with a comprehensive assessment, with some thoughtful, kind of evaluation and observation and testing and so forth, where are the margins where I feel like I might need to intervene to help them either do what they're doing better um, and continue to enhance what they're already good at, or where might we need to intervene because of the risk for tissue damage or injury. And we can go a lot of directions with this, but I also like to try to have lots of conversations with coaches as well and ask them directly the question for this player, for this athlete, what do you need out of them? With regard to their role, with regard to what they can do to stay on the court, to be available, what would you like to see them do better? Because there's always, the possibility that an athlete comes to your team and they excel in certain types of skill and certain types of abilities, but what they need on the team is maybe something a little bit different. So understanding what their role is, what are the goals of the coach? What are the goals of the player? What's their style of play, right? Something that might seem logical for one type of basketball player might not make sense with somebody else because their style of play is very different.
Nice, nice. I like how this is going. So, uh, since you're a PT background, but currently you're the director of performance and director of sports science, so how do you like kind of like I know you probably already answered this, but how exactly do you like link all like these three different areas together?
Mhm. You know, I think based on what I've already kind of mentioned, really it has to be athlete centered. It has to start with the athlete, as I mentioned, supporting what they do, enhancing what they do. So that's part of it. We try to be mindful about kind of an evidence based or an evidence informed, comprehensive evaluation and assessment. And it's not to say that each measure and metric is going to be applicable to every single athlete, but at least start there. What are we assessing? What is supported by the research, and how, does the athlete move? How do they generate force? I like to try to understand, their skeletal architecture and their joint mechanics. We really pay a lot of attention to the athletic type. I have three guys right now who play the same position, but how they generate force and how they move is very different, even for basketball players who play the same exact position. Uh, we look at their stiffness and their compliance. We have some players who are very compliant and contractile, and they generate their forces more in the traditional sense. Um, they really have great mechanics with your functional squat. They can change levels very well. And they rely on what I think many people would think of are the traditional kind of contractile properties of muscle. And we have other folks that make us scratch our head because they're athletic, but they don't like to be in the weight room, and they're kind of stiff, and they have tissue that really act like springs, right? And generate force and produce force in a very quick and efficient manner without relying on the contractile properties of those tissue. So understanding, the athletic type, and again how they generate force, how they absorb it, how they move and so forth, I think is so important. So when we think about, coming back to your question, you know there are clinical measures, and there are metrics that we're looking at from the physical therapy sense, I would say. And we actually have a paper that is going to be released soon, where me and my colleagues have looked at 325 NBA athletes over the course of 10 or 12 years. And we've tried to start to establish a reference or normative database. I'm not saying that it's complete, but after doing certain measures on 325 athletes, we have a good idea on what their range of motion looks like at the hip, at the knee, at the ankle, and in those areas. And the benefit of that is that, number one, we've learned that basketball athletes, probably not a surprise to anybody, are more stiff than your general population. But be able to define what that exactly means with regard to these measures is really helpful, because now when I'm looking at someone's hip range of motion or ankle range of motion, I know what are the normal values for an athlete, for a basketball athlete, that I'll be targeting, for my athlete, right? So that's how we kind of merge some of the physical therapy, and then what you're saying with the sports science, and kind of understanding our kinetic, kinematic, and performance data. Certainly, we get a lot of that from force plate. We're looking at the load data. I'm not a big fan of the term load management, but I do want to understand, what type of mechanical load, mechanical intensity, physiological intensity, those, those technologies are kind of showing us. And those are just a couple examples on how we try to kind of tie that together to make decisions about how our athlete, is performing. Where are they leaving some things on the table where we might be able to improve? And then how do we kind of understand these measures so that we can try to mitigate the risk of injury, and try to address that as best we can.
Cool. So, you kind of mentioned that you're not a fan of like the word of or the term load management.
Mm-hmm.
And I know, like in the sports science world, like this is probably like a big word right now. So, but can you like share a little bit your thoughts on like why are you not a fan of the word or the term, and your thoughts on like the overall managing the load?
Yeah, that's great. Great question. It's a good question. It's a big question. So I'll try to address it, and I hope my thoughts are organized. Number one, I think that there's a stigma with the term load management because I believe that many people, and particularly the public and the fans, think that load management means that I'm going to be limiting or restricting someone's ability to play, based on my control management of their load. So I think that's something that is unfortunate, when we kind of see that term. But I do feel that it's important to understand, the load that our athletes are undergoing, are generating, and the intensity. So it's not just the amount of load, but for various players, how quickly are they generating that load? How much, what's the intensity of that load, mechanically, physiologically, or whatever the case may be. Uh, I feel that when monitoring kind of those measures, again, a lot of individuals, sometimes coaches, think that, well, you're just monitoring it so you can tell me when I need to sit somebody or rest somebody. And we try to monitor that load just so we know and we can have some understanding on where the appropriate intervention might need to occur. And if someone does seem to be hitting high loads, high intensities compared to their average, then I might need to talk to the physical therapist or the massage therapist or our registered dietitian on what are the best interventions and what levers can we pull to help them recover because they're a high load. It's not necessarily that I want to sit them and just rest them. Okay. And there's a lot that can go into that part of the conversation. So, but I'll stop there because I think another element where people don't think about with regard to the monitoring of load is the other side of the bench and the other side of the equation. So when I'm looking at individuals who are my low minute guys who aren't generating the loads that my starters, I have to understand where they are at so that I know how to intervene in the weight room, on the court, with some live action so that they can be ready to play. You never know when they're going to be called upon. And if and when they are, I need them to be ready. And if they're not getting that game time load, then I need to be doing that in the weight room. I need to be talking to our skill coaches about trying to get them some live action on the court, and I need them to be prepared. So and maybe getting a little bit more detailed than that. If I have a starter in a position and I know what the demands and what they're generating are on a regular basis, I can look at that backup and say, if this person for some reason unfortunately goes down, this is the load that you've got to be stepping into and ready to handle. And I can be very objective about that because then I can try to reproduce that again in the weight room or on the court during practice. So again, if the unfortunate instance occurs where they need to be called up, I've got some metrics that I've been targeting in their training program. Does that make sense?
Yeah, yeah, yeah. I love it. I love it. I love it. So, since we're talking about like lifting at the weight room for a bit, I know like different team have like their different philosophy of like programming lift during the season. Can you
Mm-hmm.
share your thoughts on like how do you program it? Because I know some of the team do like pre-game lift, some of the team do like post-game lift, some of them do like the day after. So
Mm-hmm.
can you like share kind of your thoughts on it?
Yeah. I think there are really good philosophies and really good thoughts going into those decisions. Those of us, and I'm sure you think the same way. We obviously have to kind of understand some of the characteristics and some of the factors that relate to what's happening around the athlete. Where are we in the season? What type of micro or mesocycle am I looking at? Um, early in the season, it takes about 6 weeks for an NBA athlete from the start of the season to kind of like adjust to the demand, the rigor, the density of the games, and so forth. So how I'm training them during that first 6 weeks might be different than when we're kind of in mid-season form and taking off. Uh, so understanding kind of like the peaks and the valleys, kind of the season. So that goes into the thought process, the density of games. I'm thinking, about what we talked about earlier, the athlete type, and more specifically, um, let's take we do pregame lifts, but we don't do them across the board for everybody because it also kind of depends on what it takes to get that person ready for the game. So it's not just the same exercise program for every athlete for a pregame lift. I look at the pregame lift as, and I believe in the principles of activation, um, prep. When I'm talking to my athletes, I kind of use the term, what does it take to kind of get you ready to prime the pumps so that you can perform the way you want to perform? So, like the example I had, three guys who play the same position, um, they do very different pregame lifts because I have someone who might be kind of on that more kind of stiff, bounding, good stretch, shortened cycle kind of athlete, and someone who might be on the more compliant, contractile side. So, what it takes to activate them and get them ready to play is different. Um, Other considerations, there are so many, of course, their role, their minutes, uh, the density of the game cycle. So what goes into the pregame? I believe in pregame lifts. I think a lot depends on the factors that I've mentioned, and it really should be kind of athlete specific. So when we think about the post game lift, I know that's a very hot topic, kind of right now as well. The philosophies of giving someone a post game lift who's already active, who can, you know, can conduct a full body and get a real good post game lift, and then kind of buy an extra recovery day. Those philosophies make sense to me. Uh, but again, I don't think that it's just across the board that everyone who's played basketball needs to do post game lift. So again, we monitor their load. We try to make decisions based on their minutes, their intensity. What did they actually do during that game? Um, so there are individuals who will do a post game lift with, and others who don't, and they'll also be able to kind of help you just to understand to how they respond and how they feel after. Some guys really love it and it works out really well. Um, there are low minute guys that I'm pushing a post game lift, because I want to make sure that they're getting the volume and and the work in, and they don't fight you on it, and so it's not kind of across the board. Um, we utilize those strategies, but it kind of depends on some of these factors and who the player is, and there's no recipe or cookbook approach, in my opinion.
Nice, nice, nice. And I want to like kind of continue this conversation with uh like this idea like brought up by Matt Tuttle. Shout out to Matt. He's currently like the working with Charlotte Hornet as a
Charlotte, yeah.
yeah, yeah, yeah.
I,
And
I know Matt. I've worked with him when he was with Denver.
oh, really? That's cool. He's an awesome guy.
Great guy.
So he kind of mentioned like the timeline for like tissue recovery, not about like it's not about like after the injury, it's about like the timeline for tissue recovery for like strength training
Hmm.
and like practice. So and I thought like this would be a perfect question for you because like besides like PT background, you also have like strength and conditioning at the same time, sports science. So can you like share a little bit your thoughts on like how does like different tissue like soft tissue, tendon, ligaments, even muscle or bone, like how long does they need to like recover from like strength training or practice? I know this is a big one and a hard one.
Yeah, no, it's a great question, and I don't want to sound like I'm being repetitive or redundant, but I still think it's important to frame it in that it depends kind of on the player and some of the circumstances that we've already talked about. I try to be, kind of evidence informed, evidence based, evidence informed. I think is maybe a better way to think about it because there is some good support, for certain modalities with regard to recovery. I think the evidence is very strong that says, soft tissue work and massage therapy is really helpful, kind of in recovery. Um, there's studies that kind of show sometimes small, sometimes big differences with regard to hydrotherapy, cryotherapy, compression, hyperbaric. I think you can kind of talk about those modalities. So understanding what are the tools available, what does the research kind of show? Some of it is a little bit of trial and error, and kind of seeing again what talk to the athlete, what helps them to kind of feel better and and help them to recover. So we'll utilize those interventions if they're supported by the evidence and we feel like there's good research supporting it, but if the outcomes are there and the players feel like they're recovering and they're feeling better. So that's one thing. Number two, I'm a real proponent of active recovery, and I think the research is supportive there. So, uh, you know, again, depending on the particular situation, if I had really a high minute guy who just yeah, played a lot and so forth, then my tissue recovery is focusing more on kind of mobility, is focusing more on tissue viscosity. I'm trying to kind of normalize the tissue by doing slow isometric contractions, squeezing out some of the inflammatory, processes, that are making them sore. And, so focusing more on, core, mobility, um, flexibility, movement, kind of post game active recovery. And then the intensity and the load might go up uh, for my more lower minute guys and so forth, where, all right, here's an opportunity for us to kind of make some gains. I'll say one more thing. I hope I'm not going too much on a tangent, but we like to kind of classify things like many strength coaches with regard to our exercises as being kind of prescriptive, corrective, or performance. So kind of even demarcating that and saying, in some instances, I need to do something corrective, and corrective is transient. There's a motion, there's a movement, there's something that I'm trying to improve. So I'm trying to do specific exercises. Sometimes they're unilateral or asymmetrical because I'm trying to correct or improve something for, whether tissue is reactive or whether their force production isn't where I want it to be. But, I'm going to correct it until it's hopefully corrected. Prescriptive to me is more related to the idea that none of us, kind of are born perfectly, I don't want to use symmetrical, but sometimes there are exercises that we just kind of need to do a little bit for the rest of our lives, regular dosage, kind of like a vitamin, kind of like a medication, because maybe I tend to have a little back pain or I tend to have a little hamstring. So there's certain kind of prescriptive things where they just have to have a regular dose, even if it's a minimal dose, regularly. And then there's the things that we do to try to make them bigger, faster, and stronger. So kind of coming back to the point with regard to tissue recovery and timeline and so forth, depending on the demand that they underwent in the game, I'm looking for those opportunities, to sometimes work on, those types of exercises. I think I got a little sidetracked here, but those are some of my initial reactions.
It's okay. I love it. I love it. And because this is a hard one and this is a big one, but I love it because it definitely depends. Different athletes always gonna have like different like 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 their training history, all those stuff. So it definitely depends.
And we don't want to throw our arms up in the air and say,
Yeah.
well, it depends. So we still want to be thoughtful about it. And I think that's the important thing is to be mindful and be strategic about it.
Yeah. Yeah. So I want to jump into the next topic. I know you kind of published a paper about like how the hip affects how athlete moves.
Mm-hmm.
And so can you kind of share like because I think this also kind of like correlate with what you mentioned, like maybe corrective or like pre-game lift, you mean like activates a muscle. So can you kind of like share like how does the hip affect overall how athlete moves?
That's a great question. You never want to say that one joint is more important than the other, but the hip is clearly important, for our athletes. And some of this relates to the earlier conversation about how compliant are their tissues and how stiff are their tissues. So that's one thing, that's one measure that we'll be looking at with regard to kind of their hip joint mobility, their hip range of motion, because that'll help to determine, right, whether they're moving, the required or the necessary, right, the functional amount or not. I feel like when you're thinking about the hip and how it affects athletic movement, we have to be mindful about joint structure and have some baseline information about some of the skeletal architecture. Is the hip anti or retro torsion, anti or retroversion? And the difference between torsion and version is important right out of the gate, because I can change the angle of version, by changing soft tissue, strengthening, stretching, whatever the case may be. But torsion is a bony twist, and I can't untwist the bone. So just knowing what's modifiable and what's not modifiable, can start. And again, the degree of version or torsion is going to, right, affect, their mobility. And I have players, who have incredibly compliant hips, and they're able to get low. They're able, to move, to the extremes of range of motion. But then the challenge is that they have to be able to dynamically stabilize and control that. And you know, I have a player right now who has an incredible amount of motion at the hip, uh, but neurologically, his neuromotor control is excellent, is elite, and we think about that on, making sure that we're not letting that hip joint get too far into the extremes of the range of motion, because his range of motion is much greater than your average NBA athlete. I have another player, when you look at their hip motion and you try to have them change levels or move into a certain direction, he's literally getting bone on bone. He's not gonna move any further, or not much further than where he's going. So again, understanding, kind of the skeletal architecture, how deep is the socket, how deep is the acetabulum, do we have cam or pincer types of deformities, tendencies for FAI, and so forth. So understanding their anatomy, their biomechanics can really help us to kind of frame our expectations with regard to how much motion is available. Um, Obviously, it's very important athletically and for basketball players. So another thought that comes to mind that I try to be mindful of is watching game film and looking at their ability to change levels, because I think we would agree that there is kind of a range where you're trying to balance their ability to move and their motion and their available range of motion and their ability to generate force and power. But if they get too low, they can lose some of that ability to move because they're too deep into their socket. And of course, if they play too high, then they might be getting beat all the time, by an opposing player. So my point there is watching your player and trying to determine, like, where is that functional range? Where is their range and the level of ability where they can kind of maximize their mobility and maximize their strength. And it's a little bit different for different players. And then with regard to some of the other qualities that we talked about, where can I push someone who might be able to get a little bit deeper, who might be able to get a little bit more external rotation, range of motion? Where are the margins, and where are the areas where I can push that a little bit to hopefully improve their performance without increasing their risk of injury.
Nice, nice. So this kind of brought me to another question. This is also like a paper you published. It's about like the utility of like functional movement screen
Mhm.
on NBA players. So
Mhm.
a lot of stuff you mentioned is like more deep into like movement assessment, probably. There's like different system, probably SFMA or like different stuff. But like in terms of like FMS, do you think that it is like really going to be helpful for like when we talk about injury prevention or like understanding how athlete is structured?
Mhm. A couple things. I think a lot of us hope and look for like the silver bullet. What is the test? What is the assessment that's going to give us, all the answers and all the information? And of course, that doesn't exist because, people are more complex and our athletes are more complex than that. I want to frame, that paper in that, we did that because many teams were gathering FMS data, and this was kind of new, when it was first kind of released. And I give Greg Cook and all those folks all the credit in the world. I think why it was developed and how it was developed was coming really from a good place. But the reason why he did that study is because our colleagues were like, we have all this data, but we don't know what to do with it, and we don't know if this is good information or not good information and so forth. So we started to just try to understand that. I feel that functional movement is very important to kind of understand. I feel that one of the ways that we utilize some of that work, and it's not exactly the way it was originally described. I feel that it gives us good qualitative information about how people are moving. So the force plate can give me, again, good information, with a counter movement jump on forces produced and asymmetry and so forth. But an FMS squat can kind of give me a little bit more information. A functional squat can give me information about, you know, what's happening, at each joint throughout the kinetic chain. Um, Another good example, I don't want to bore you too much, of where we've gotten some good information from the FMS is the hurdle step. It's not part of the original screen, so and I hope the FMS folks aren't getting mad at me for this. We still score it, kind of the way they recommend. But what I've found is that when someone is conducting the hurdle step and stepping over the hurdle, the two strategies are for someone to either internally rotate or externally rotate the hip to kind of get the leg over if they can't go straight over with the hip and knee flexed, kind of appropriately as the criteria kind of indicates. So it lets me know right away if someone is internally biased or externally biased at the hip joint, because they're going to try to follow the path of least resistance. So does that make sense? The strategy on how they're moving all of a sudden gives me information. It says, oh, this person tends to go into IR. So I want to know how much that is. I want to know how they're controlling it. This person tends to go into ER. And it gives me some qualitative information about how someone's moving. So we like functional types of movement, but we never look at it in a vacuum. You don't make a diagnosis based on an FMS and watch how someone moves and say, oh, well, you've got glute med weakness. Well, you don't know if that's happening, if the movement is happening from the hip or the knee or or the medial longitudinal arch. You just see the movement, but then it's our job to then look at the clinical measures, look at the other assessments to determine why they're moving the way they're moving. I'll say one more thing. I think people forget that a functional movement screen is a screen. And what a screen does medically or in our world is it looks at a general overview, high level overview. And then we, as the clinician, look at that and say, do I need to do further testing? Do I need to go a little bit deeper and explore something that I didn't like about the screen? But I don't think a screen is ever intended to be diagnostic. So I think if we're doing that SFMA or whatever the case may be, I think we're missing the boat on it.
Nice, nice. I love it. I love it. So, last question, okay? I know you did like Achilles tendon and ACL paper with Adam. Shout out to Adam Perry. And I
Mm.
know you did like return to play paper about like groin injury and calf injury. So for and for all those like injury, like do you have like a return to play protocol for like different injury, and how do you kind of like build that protocol or like blueprint?
I think it's important to have return to play criteria. I mean, we can call it a protocol. Um, I think it's important to, before the injury occurs, to for performance staffs, sports medicine staffs, to kind of look at the criteria that they feel are important to allow a safe return to play. And well, I'll talk about what those criteria are. I also feel that within that group of criteria, that those involved, in my opinion, but it's my professional opinion, need to determine what criteria are deal breakers and what criteria are kind of okay, where it kind of might depend on the situation a little bit, if that makes any sense. Um, we utilize obviously the clinical data, the clinical measures has got to be part of it, you know. So understanding the normative and reference values, you know, for NBA players is important, but also I better have baseline data when before they were injured, so I know, you know, hopefully what their normal was, or at least where they were right before injury. And of course, we have the other side to compare to as well, medical imaging. You know, you talked about Achilles and so forth. So we utilize, you know, diagnostic ultrasound, and we want to kind of look at the structure. We want to have some idea, and other imaging, you know, kind of as necessary. um, Again, it's important to have kind of baseline pre-injury data on some of those functional tests, those performance measures, and so forth. And then all of this, you know, depends on the degree of the injury, the anatomical location of the injury. You mentioned Achilles again. You know, is it mid-substance? Is it, you know, myotendinous disjunction? You know, all those things kind of affect it. You know, so I think it is important, right, to have the return to play criteria, you know, kind of in place, because then when someone does get injured, it's like, when I'm going to allow you to return to play, these are the measures that are not negotiable. You know, for us to allow you to safely, but you better be able to, right? Whether it's a strength asymmetry index from the previous measure or the other side, whether it's the heel rise endurance test, or, you know, how they're performing on the Delos or the YBT or dynamometry and so forth, you know, have that, you know, kind of in place. Um, where necessary, you know, the performance type of data, force plates, kinetic, kinematic performance, hop testing, you know, is a big part of that as well. The progression of court activities, you know, that's not something that you could just kind of write the recipe for, but, you know, yeah, you know, kind of getting them back on court, and kind of progressing that from non-contact to contact, and seeing how they perform and so forth. And then there'll be other criteria that might be more negotiable, because, you know, we understand in this day and age as well, you know, players want to play, you know, and so forth. And sometimes, you know, athletes have incentives, you know, kind of related, you know, to the number of games that they're playing, or, you know, or they're vying for, you know, postseason awards or whatever. And those are important issues. Um, you know, so sometimes there's other criteria that might be, uh, you know, less of a deal breaker, and you just want to have a good conversation then with the player, uh, and others who may need to be involved.
Nice. Man, I learned a lot today. Like literally learned. I
I hope
take
so. I feel like I'm all over the place, but I
no,
appreciate it.
it's awesome. I feel like I take a lot of notes today. It was awesome.
Mhm.
So
Appreciate that.
yeah. So I know you do like annual like symposium,
Mhm.
and like you mentioned you own like two like physical therapy center. So
Mhm.
for those who are interested in what we're talking about, no matter it's like performance side or like the paper you published and the annual symposium, where can they find these information?
Yeah, I appreciate that. You know, you can find me on LinkedIn, you know, if you want to contact me. I'm on the other social medias as well, and, you know, try to share kind of like what we're doing or those opportunities. We do have a symposium, an annual symposium. This year we're actually doing it live. We've done it online in the past because, you know, we can reach a broader audience, and, you know, and even speakers, but there was an interest in like actually getting into our weight room and onto our court and doing things physically. So on September 7th, We're holding a symposium, kind of in Dayton, Ohio. I'm on ResearchGate. So if you haven't gone on ResearchGate, I try to make the articles, that I work on, available in the public domain. So you don't have to go through other steps to get access. I'm always grateful, when people, are interested in the work that we're doing. So yeah, I think those are some places. Orion Sports Medicine, Orion Physical Therapy. We have websites that you can get access to as well.
Nice, nice.